If you're experiencing a sharp pain in your rib, this video and 10-minute mobility flow is for you. I'm Dr. Mae Hughes, a pelvic floor physical therapist, and it is really common for your ribs to start to develop a little pain in the second trimester or third trimester because during pregnancy, your ribs actually expand anywhere from 2 to 3 inches to accommodate the growth of your baby, which is needed, right? But sometimes all of that stretching and expansion can cause a lot of compression and nerve irritation and just uncomfortable sensations, not to add on a potential foot that might be kicking you in the ribs. So today's mobility flow is all about relieving pain in those ribs. All you need is really a mat, and I have a rolled up sweatshirt. Maybe you've got like a soft pillow or towel roll, that will work as well. So let's go ahead and get started. In a side lying position, we're going to create some room in those ribs. So you're going to get on your side and place the sweatshirt underneath of your rib cage. We're going to do this on both sides. You're going to lay across that pillow. So we're basically compressing the bottom ribs to encourage expansion on the top. You can do whatever you want with your top hand, maybe put it over your head, drape it long, whatever feels good for you. And you're going to inhale through your nose, expanding your ribs 360 degrees. And exhale, let it all go. Maybe you need a tactile cue. Place your hand along those upper rib cage here. Inhale into your hand. Feel that expansion and exhale, let it go. We're focusing on trying to breathe into 360 degrees of our rib cage. Inhale. Exhale. Inhale, expand. And exhale, release. You can remove the towel roll or sweatshirt or wherever you have, but keep it nearby because we will do this on the opposite side. I'm actually just going to place it under my head for a little pillow. You're going to stay on your side, but bring your knees a little closer and towards your chest. And now see, can you bring your hands out in front of you? And then you're going to perform either a windmill or an open book, whatever feels best for you. Where you're going to reach your arm up and overhead and rotate around. Maybe you feel a little crack in your back. That might feel good to you. A nice modification is to put your hand behind your head. You're just going to open up that elbow. Chest will point up towards the ceiling. Feeling a good stretch through the upper back and the rib cage as well. Maybe you sink into that a little further. Whatever feels good, the windmill or the open book. For 4, 3, 2, and 1. Now we're going to perform both of those exercises on the other side. Carefully make your way to the other side. I know moving around at this point in pregnancy feels like an Olympic sport. Alrighty, so you're going to place that towel roll or sweatshirt, whatever you have, underneath of the opposite rib cage, allowing it to compress the bottom ribs to help encourage expansion on the top. You can drape your arm long. Inhale, expand into the ribs. And exhale, let it go. If you need that tactile cue, place your hands along the upper rib cage. And exhale, let it go. By working on this deep diaphragmatic breathing, we're also getting really good pelvic floor lengthening. So it's kind of a 2-for-1 here. You're working on rib cage expansion and releasing tension in those ribs, but also getting some good diaphragmatic breathing and feeling your pelvic floor lengthen. Let's do one more together. Exhale, let it go. All right, remove that pillow or towel roll for a windmill or just a side lying, thoracic rotation or open book, kind of whatever feels best for you. So remember, windmill, you're going up and over. Oh, I'm definitely tighter on this right side. Or for that thoracic rotation, you can place your hand behind your head and just open up towards that ceiling. I know this is a good modification for maybe those who have shoulder pain. because it's just a little bit of a shorter lever arm. Now you might be thinking to yourself, oh, I thought I was told you can't rotate or, move, twist in pregnancy, and that is completely false. It is okay for some gentle movement and rotation. In fact, that's why you can get really stiff in the ribs, because a lot of people will avoid rotation, but your ribs and your thoracic spine crave that rotation. So if you aren't giving the body what it craves, then it gets a little cranky at you. Alrighty. That was the last rep. Now you're going to move into a comfortable seated position. Maybe that's crisscross applesauce. Or maybe you're on your knees. We're going to perform some seated rib circles here. So you're going to place your hands on either sides of your ribs, fingertips in the front, thumb pads in the back. And you're just going to imagine you're drawing circles with your ribs on the mat below you. Maybe take note of what feels stiff, maybe what feels difficult to do. Usually one direction feels worse than the other, and go ahead and switch directions. Really think about pushing back into those ribs. That's where we tend to lose a lot of space, is posterior expansion of the ribs, just because everything's pulling you forward with that growing belly. And so the back of the ribs tend to get really compressed. And then the front of the ribs will get overly expanded. You've got 4, 3, 2, and 1. Moving on to a 90-90 hip thrust and reach. Move my towel or sweatshirt out of the way. So you're gonna get into a 90-90 position, kind of where the front knee is bent and the back knee is bent as well. What you'll do is lean towards one side of the front bent leg. You're just going to reach up and over as you thrust your hips forward. You should feel really good stretch along the side body, feeling the ribs open up and then come down. I like to pair this inhale with the hip thrust, because when you inhale, you're encouraging expansion on the side to which you are reaching. This feels so good on my ribs right now. And the hips again. Let's go ahead and switch sides in 4, 3, 2, and 1. Go ahead and switch sides. So now I'm leaning to that left. I'm going to inhale, thrust up, reach up and over. Imagine you're reaching up and over a large balloon or beach ball. So it's not just a compression. You're not just going straight over to the left, but you're going up and then over. For 5, 4, 3, 2, and 1. Return back to a comfortable seated position for a seated reach and pull. We're going to do one side at a time. What this looks like is you're going to reach up and over just like you did, but this time on the way down, we're going to make it more active for the side body and the upper back. So you're going to exhale through pursed lips. But as you imagine, you're almost performing a pull down. Imagine you had a band and you're trying to pull it down by squeezing your shoulder blades. I'm actually going to turn around so you can see my shoulder blade from behind. So you're reaching up and over, then exhale, pull the shoulder blade towards midline. As you engage that deep core. So we're working on going from a lengthened position of the ribs to a more stable position. For 5, 4, 3, 2, and 1. We'll switch sides. I'm going to turn back around now that you can kind of see what's going on at the shoulder blade. You're going to reach up and then pull that arm down. I'm not bringing my elbow much lower than the height of my shoulder, trying to stay almost at 90 degrees. When I exhale through pursed lip, Pursed lips, I am imagining I'm zippering up my core from my pubic bone all the way up to the base of my ribs. For 5, 4, 3, 2, and 1. Our last exercise will just be ending with some deep core contractions, aka hugging the baby. I'm going to turn to the side so you can see a little bit better what's going on at my belly. You can stay seated in a comfortable position if that feels good for you. Place your hands on either sides of your ribs. Inhale through your nose, expanding your ribs 360 degrees. Then exhale, blow that air out through pursed lips as you gently lift your pelvic floor up and in, and then zipper up your core from your pubic bone to the base of your ribs. Your ribs knit together and then also move back in space. Inhale, expand. Exhale, zip. Inhale, expand. Exhale, zip. That forced exhale is working to strengthen the internal obliques, getting those intercostals back online a little bit. Inhale, expand. Exhale, blow out all that air. One more together. Inhale and exhale. Amazing, y'all. Congratulate yourself on taking just 10 minutes to feel a little bit better throughout your pregnancy. If you have any questions about the movement flow, please drop a comment below. And if you want a fully guided and structured prenatal program that also includes some pain relief flows, just like the one you saw, that's exactly what we work on in my Movement Through Pregnancy program, and I will include a link for it in the description below.